Hi everyone, greetings from Houston, Texas. It's a cold and rather windy day today. I wanted to talk today about gout. It's on my mind. It's one of those diseases that doesn't get as much publicity, and a lot of patients and folks in the community do not know that we as rheumatologists are the experts in gout. So gout is an acutely inflammatory joint disease which results because there's accumulation of these uric acid crystals which forms these clumps called tophi, and then that can accumulate in certain joints and cause extreme inflammation, pain, swelling, etc. So how do you treat gout? Definitely, looking at your diet, making sure you're not consuming a lot of red meat, which is pork, beef, seafood, alcohol. So dietary interventions are very important along with good intake of water. But most importantly, if you're having recurrent gout flares, you need to be treated. Now, during acute flares, you can treat it with steroids, either orally in the muscle or into the joint directly. You can also be treated with what we call NSAIDs or non-steroidal anti-inflammatory drugs, colchicine, etc. Some of these medicines can have side effects or long-term side effects if taken continuously. I've talked about steroids in the past. NSAIDs can cause kidney toxicity and elevate your blood pressure if taken continuously. So ideally, if someone is having more than 2 flares a year or has definite tophus, we recommend treatment with chronic uric acid lowering treatments. So that treatment includes the use of medicines called uricosurics, which is allopurinol or febuxostat. These are oral pills that have to be taken daily along with monitoring of your blood work periodically. However, if you're continuing to have flares and your uric acid is not at goal and you have been optimized with your oral gout treatment with allopurinol or febuxostat, there is a new treatment which has revolutionized gout treatment. It's called Krystexxa. It's actually an enzyme called uricase which breaks down this uric acid and converts it to a water-soluble product called allantoin that is excreted in the urine. So this is an IV medicine, has to be given under the supervision of a medical doctor, especially like a rheumatologist. It is administered every 2 weeks. You do need to get your uric acid checked before each infusion to make sure you're not at risk for developing infusion reactions. We also know nowadays that starting treatment with a medicine like methotrexate a few weeks prior to this medicine can help reduce the risk of infusion reactions. This medicine can be used for 6 months or longer, and we do need to make sure that the G6PD level is normal before we start it. Again, this is a very good medicine if you are continuing to flare while on the gout medicines we talked about, allopurinol or febuxostat, or you have these clumps of uric acid crystals called tophi. So if you are having these symptoms, please talk to your doctor. Please see a rheumatologist in your area to discuss your options so that you can live a good quality of life. And of course, we Lonestar Rheumatology serve the greater Houston area. So if you're in the greater Houston area, you can call or text us at 713-588-1674, and we will evaluate you and see what treatments are best suited for you. We also have an infusion suite on site. So if Krystexxa is the correct medicine going forward, we can administer that as well. And of course, monitor you. Monitoring is very important when we talk of any chronic condition, including gout. Again, I hope this helps for all of you out there who are suffering from gout or who have friends and family members who have gout, but you were not aware of what to do and which doctor to see. This is Dr. Nilanjana Bose from Lonestar Rheumatology. Thank you. Bye-bye.